Hello everyone, my name is Ninh. I'm a research associate at Health Economics and Data Analytics in School of Public Health, Curtin University. Today I would like to present my study on trend and factors associated with repeated CT scan in tertiary hospital using link administrative data in Western Australia. To begin with, I would like to provide a brief background on CT scanning. This is a powerful diagnosis tool which uses computers and rotating X-ray machines to create a cross-sectional images of the body. It's used to diagnose it and assess progress of the disease and interventions. Although it's a powerful diagnosis tool, every CT scan delivers a radiation dose to the body. Let's have a look at the risk of medical imaging radiations. As you may know, we can expose to natural radiation from everywhere, such as cosmic radiation and plants. It's estimated that the background radiation accounts for 2.2 to 2.4 millisieverts per year. So millisieverts is a unit used to quantify the effective dose of biological risk of radiations. From the medical radiation exposures, a standard chest X-rays can equal to 3 days of background radiation. So it's at a very small additional lifetime risk of cancer, just 1 in 1 million. But with one CT scan in chest, it's equal to having 400 chest X-rays. So it's make up 3.6 years of background radiation. It can add up 1 in 1,200 additional lifetime risk of cancer. So similar for CT scan in abdomen. In Australia, CT scan use is increasing. The total number of CT scan billed Medicare were only 500,000 in 1993 financial year, but in 2012, the number is 5 times higher with a total of 2.5 million. Similarly, for total cost of CT scanning, it's increased from 145 million in 1993 to nearly 800 million in 2012. So increasing use of CT of diagnostics imaging also result in growth of follow-up imaging. A study looking at abdominal imaging found that a repeated imaging within 90 days was seen in 43% of CT scan examinations. Repeated high-cost imaging examinations such as CT scan pose a concern about resource utilization and expose patients to potential unnecessary radiations. Although reducing rate of repeated testing have attracted attention from healthcare policy makers as a way to improve quality of care and reduce costs, relatively little information exists on the frequency and pattern of a repeated CT scanning. So in this study, we will aim to quantify the repeated CT scan and its trend, and also examine the factor associated with repeated CT scan in a tertiary hospital. So for the data source, in this study, we have 3 main data sources from hospital mobility data, emergency department data collection, and picture archiving communication system. We use this data set to provide information about diagnosis, admission, and discharge days, the basic demographic and socio-economic status, as well as city utilizations. As the data source only fully capture the city use in the tertiary hospitals, so this analysis is limited to tertiary admission only. The main measure is repeated CT scanning, which defines at admission having more than 1 CT scan in the same anatomical area during tertiary admissions. In addition, we also measure the basic demographic and clinical characteristics such as age and socioeconomic status. For the statistical analysis, we examine proportion of repeated CT scan and identify characteristic of population with repeated CT scan. We use a choice point regression analysis to identify the periods with a significant change in the rate of repeated CT scanning. So for the results sections, this table represents the percentage of CT scanning and repeated CT scanning for the whole study periods, the recent 10 years and the recent 5 years of the study periods. While the percentage of CT scan is increasing in more recent period, the repeated CT scan seem reducing. We also looking at who and which condition that dominate the repeated CT scanning admissions. So the repeated CT scan were found most common among males, people middle age group, and people living in less accessible areas or highly disadvantaged, or people with unplanned admission or admission with major surgical conditions. We also looking what is the top 5 diagnosis of the CT scanning. So this graph is for head CT scan. Repeat CT scan account for 12% of admission with the CT scanning. So repeated CT scan in heads were most commonly for diagnosis related to trauma. For abdomen and pelvic CT scanning, repeat scanning account for about 9% of admission with abdomen and pelvic CT scanning, and the top condition with repeated CT scan were related to digestive system, such as intestinal obstruction and abscess. For chest CT scan, repeat scanning was 6.3% among admission with chest CT scanning. Leukemia and pneumonia were in a top diagnosis with repeated chest CT scanning. For the trend of the CT scanning, this figure presents the trend in repeated CT scanning by sex from 2003 to 2015 identified from joint point analysis. And you can see in this figure, a significant reduction in annual percentage change were from 2007 to 2012, with a reduction of 4.5% each year. Similar patterns were observed across age groups as shown in this figure 6. However, when we're looking at the trend by different anatomical area, we can see which type of CT scan driving the trends. While the repeated CT scan in abdomen remain unchanged over the study period, head and chest show a similar pattern which we observe across age group and sex. A significant reduction in repeated CT scan observed after 2007 could be explained by the introduction of 4-hour rules program in tertiary hospital in Western Australia at that time. The program aimed to increase the flow of the patient in ED, so patient had to discharge, admit or treat within 4-hour presentation. So literature show an increase of requests of diagnostic imaging in hospitals, but reductions in the request of the ED during that time. So another reform is the activity-based funding start in late 2011. That's corresponding with the upward trend in 2012. Although this study not focus on evaluating the policy, but this may reflect some impact of the policy on the diagnostic imaging use. So what are the key findings of this study? So we found that 10% of admission with a CT scan having repeated CT scan during hospital admissions. So the most common repeated scan was in head or male people living in less accessible area and or unplanned admissions. We observed a significant reduction in repeated CT scan in the period after 2007, but slightly increased in 2012, which is corresponding with the major health policy change during that time period. At our current study, we're limited to the time in the tertiary hospitals. So our further study will combine with the data of CT scanning outside hospitals to have more comprehensive pictures on repeated CT scan. And we're also looking at the cumulative CT scan in person over time to have estimate the radiation exposure dose. So I would like to acknowledge our project team members for their contribution and support in this work. I also would like to acknowledge the National Health and Medical Research Council for the grant and thank the WA Data Linkage, Data Custodian and Imaging West, and for all those data we use. Thank you very much for watching my presentations.